Hello, everyone. Good afternoon. Dr. Rao here. Found some time I wanted to come and communicate with my friends. So here I am. Hopefully, you are having a good afternoon like everybody else. Hi, Mark. Nice to see you. So, once in a while, I come with the spirit of providing some service if it is needed. Um, I talk about having this attitude of service in the morning routine while we go on embarking a day of our work, whatever it is, uh, if it is given in the spirit of service, it is better for the person who is receiving the service and also the person who is providing the service with a spirit of giving, spirit of helping, spirit of uh, really to be there when other human beings or animals or plants, anything needs us, right? So I think we are kind of programmed to kind of put that as though a sucker's attitude, you know. But this attitude of I have to get something, then only I will do, is really producing a lot of suffering, not only for the people, for the others. One of the faculties we have as a human being is to be able to give, right? Where give without any expectation is better than giving to get something, right? So when I come on this, I want to always remember that I don't want anybody as a customer for me or uh, using the services, and if they need them, they will use. Otherwise, it's okay. So, so I'm out of that advertisement, seeking people to um, sell them something and all that. Okay, so I'm comfortable that way. Uh, I could help with a lot of people though that come to me. So that was happening. And but when you are doing that, you don't want to be egotistical. You don't want to be acting like I'm the one who is providing it. That's the real karma yoga is where you don't have an agency and you are not claiming for any results, any fruits, whatever that comes, you just take it as gift of God. In India, there is a word called prasad. Prasad means the food that you prepare, you offer to the God first, and you don't eat it at all. You don't even taste it. And then once that is offered to Him and whatever puja, whatever they perform, then they take it as His blessing, right? So if you approach an actor like what are the difficulties, uh, what are the good things are happening, like his blessing, his giving, the God's giving, that has got a tremendous meaning. People really value that food that is given in temples because they have this attitude of that is given from the blessings of the God. Okay, it could be a belief for them. It could be something that they are imagining, but still it works wonders for them because they are blessed by God in the form of that food or whatever given in temples, right? But a extended view of that is whatever happens in life, okay, in my life, whether the good things or bad things, like the prasad, blessings from Him. For example, you have illness, a difficulty, then it's like telling you that something is wrong, take care of it, you know, or some difficult situation come so that you can learn to overcome the difficult situation by really displaying the resilience that is needed. And through that experience, you gained a lot of knowledge about yourself and also a lot of capacity that otherwise would not have come out. So you could know, I could do that, I could bear with that, I can think about it. I can maneuver around the situation. That kind of thing, right? So think like that. Prasad of God of whatever situation is. Then you can ask like a test me God, not ask why me God. Actually, this was very useful for me when I was uh, you know, in recovery. I think from the stroke I had. That was like a dream now, but I had a paralysis of the left side, right? And I was lying there, and then one of the things I had was I was listening to a philosophical talk by what's called Brahma Kumaris. It's a women empowering spiritual entity in India, based in India. All these women are really. I went there one time to see their place. They have this wonderful smile on their face. They wake up early in the morning at 5 o'clock and they work through all the lunch and dinner through 11 o'clock at night. And they get up early in the morning again and they do that. But I did not see any irritation. I did not see any curtness or anything like that. They were genuinely hospitable and they were genuinely affectionate in the sense they have this wonderful, inviting smile that healed you. The moment you see the smile that heals you, like, so those people are wonderful. She was her name is Shivani, and she was on my YouTube channel or whatever that I was listening to, and she was bringing up this in. Don't say why me, God. Say test me, God. Okay, I will take it. Why not? So, and that really sparked all that you know the prasad talk I gave you, and the whatever happens in life, you can take it as that, and then grow from it. And then what happened? I kind of recovered from that stroke completely within a month, and then there was some limp on the left side, but then I kind of overcame the speech problem, the weakness on the left side, and also, everybody thought I'm done, and then I'm going to go into nursing home and spend my time there. But I kind of, came back through it, and then doubly, uh, what he revealed was stroke patients are not getting enough rehab. So I was very aggressive on my rehab because of my knowledge of the stroke and how I treated maybe thousands of patients before. And it helped me to understand people are not using breathing in rehab when I went through the rehab. And I taught all the therapists there the deep breathing. And also how people are when they're afflicted with a chronic disease really make their own mind their own enemy, because they may have been set with something like, I'm going to achieve this in my life, I want to do this, I want to do that, and all that. And then the reality is you have the deficit you may not be able to do, and then it really implodes your own mind. Okay, that is something I didn't have because I was practicing being in the present and facing things as they are, right? That's what the ancient wisdom taught me about life is really in the present. You could have insights from your past experiences and you can aspire for something new, but then if you don't do the present properly, you will not be able to realize what you want in the future either. And that too, long term gain and not the short term gain and all that. Anyway, my mind is in a good frame of mind. Like I take it as a challenge. I'm going to put everything into the present moment and go from there. I did use my medical knowledge. I did use my insights into ancient wisdom. First of all, I was able to be in the present. I wasn't regretting or I wasn't really despairing for the future, what may happen, none of that. One day at a time, truly. really in the present. And that is our life, by the way, you know. And then the deep breathing, and that really relaxed the mind and made it much easier for the muscles to recover, and uh, really made my mind occupied with the breath, right? You have to give something to the mind, otherwise it will go all over, right? So I did not do that. And then the other thing was micro yoga. So now I'm helping other people to recover from joint problems, or arthritic problems, or hypertension. So many conditions where they could use this micro yoga. The person who has a severe joint disability may not be able to do the regular yoga we teach them, but this micro yoga is only dealing with a finger, for example, or one hand, for example, or one filament of that, right? All these things help you to really uh, do that yoga in a micro way, you know. And the mind is a subtle body of ours. Once you approach it, mind as a subtle body, you can do a lot with your thoughts, right? Anyway, my understanding of the ancient wisdom, the yoga, the Ayurveda, Vedanta, all that helped me a lot. And then I bounced back completely so that I could go and see my patients in 1 month. And everybody thought I was crazy. I was kind of weird, or something like that. But I said, "Oh, it's a nice way. It's good. I got my life back. I'm doing. I'm with my wife and kids again. I'm kind of providing things and all that, right?" But also the expanded horizon on the medical front is how these chronic diseases are killing us, really poor outcomes, and we are pouring so many millions. Acute care is good, surgery is good, but then rehab, lot to be aimed for, and also not allowing these chronic diseases to go on. So there are so many wellness ways that I learned in the ancient times systems. So I brought them into my life. I was a little bit more like that, but then still being a busy doctor, I was not able to do everything that I wanted to. The chance of staying away from the practice for some time, even a few weeks, gave me really employ all that. Okay, and then I was continuing. So this happened in 2014, almost 10 years now, right? Yeah, 10 is over. August 23rd, I think we had. So 10 years and 1 month now. I just remember all the dream. I don't regret it. I kind of see all the positives happened because of that, right? And then I became normal again. I became about seeing the patients and all that. And I ran the clinic till 2019, when it was getting, all the insurance companies they're giving a lot of trouble for payments and all that. Right then, somebody came to buy the clinic building, and we sold it. Lucky, 2019, around May, I think. And then 2020, COVID broke through. So I was really lucky to get that one done, right? And then I put my effort into how can I emphasize my original philosophy of roots of illnesses is what we are going to focus on, not just the processes of disease. We will focus on the process. We have a pneumonia, we go to treat it, definitely. But we also want to see why your immunity down. How come you got the pneumonia? If you are an elderly patient, maybe you did not get the vaccination, or you are spending in an atmosphere that is giving you, like as a nursing home and all that, right? And how to protect the other patients, that like, right? So we are always attending to the roots of no matter what illness you came, even allergies, right? So we were always trying to figure it out, right? That was our clinic. My philosophy when I established my own clinic in 1997 was about how can we really go into the roots of your illness and maybe help someone, maybe change your lifestyles a little bit, maybe uh, decrease the morbidity of the disease, that the suffering and pain that can result from the disease, how can we lower it down? Or how can we not aggravate the complications? Or if you could, we could completely take away the root cause and make you better altogether. So those were the aims. As I said, but the philosophy was printed. We are going to attend to the roots of your illness, not just the process of your disease. Okay, we're going to attend to the process anyway. But then, apart from that, we ask questions about what is the family like, how is your economic life, how you are adjusted with the world around you, how you are adjusted with yourself, your loved ones, and all that. So a lot came out from that, and then the more we spent time with the patient, the more they were able to communicate freely and tell us, yeah, this is what is wrong. That's why I'm not having my blood pressure controlled, because I'm not able to control my reactions. I'm yelling at people. I'm doing a lot of, but when I'm angry, I'm hurting myself more than others. Once they realize that, they kind of figured out how to tolerate or how to respond without getting anger and all that. So we taught a lot of things like that, right? But then this has taken a whole new perspective now. Why chronic disease so much? Why it was not there in earlier times, in the ancient times? Why yogis live so many years, live very well, actually, physically, mentally, and all that. So a lot of insights that I already knew I wanted to put into practice for myself, for my family, for my patients, and everybody. So I went ahead and formed this company, BFL. The whole aim of that PAL is how can we optimize wellness? Let it be individual, or the society, or the corporations, or the planet as a whole, right? So it is not really a far-fetched idea, because if you can understand preventive measures in a much bigger way, not just annual physical, but teach patients how to take care of their health better. Addressing all the roots of pillars of wellness: the nutrition, the optimal exercise, the rest and sleep, and mind management. Mind management, however, that is from the ancient wisdom. They knew what is mind, how does this operate, how that is also a subtle body. Like the physical body is our body, the whole mind with all the thoughts built it up, our own experiences, reactions, concepts, everything. The whole thing is a really a subtle body. Once you understand that, then you don't react to them as otherwise people react, as though thoughts are there. Some gap. Okay. Then I devised so many programs where people can come and, uh, for example, somebody had a surgery on shoulder, rotator cuff. That's a very common injury, and we used to see a lot of people. We used to refer to orthopedic rotator cuff injuries, but rediscovered for surgery. And unfortunately, many of those patients did not recover complete function after that. Shoulder is such a easily movable joint. To get that natural function after the surgery was very difficult. Maybe sometimes the surgery was not done properly, not because of intention, but then it requires extraordinary skill. So we used to search for surgeons who are really having a high, but then insurance restrictions limited us. Okay? But if there is no limitation and the patient is willing to go to surgery, we had referred some in Texas, some in India, like that, right? But it's up to them to make the decision. Okay. Uh, so this person came to me after the rotator cuff injury and going through the rehab. She is going through that. She happened to be a pediatrician. I met her on Clubhouse, and we were friends. So when she told me, I told her, come and I will show you. And so she came to my wellness club, and I taught her shoulder exercise yogic way, right? How you do it. In yogic way, you don't press on a goal and then say you do all these things till you are hurt and all. No, you take from where you are and then slowly increase in gradations the exercise amount that you do. So if you are able to lift up the shoulder a certain way, and then beyond that it pains, don't press on that. Just go only up to the point where you can tolerate, and then you may test a little bit slowly later on. So you require discipline, you require consistency, and you require the willpower. Okay. But then once you are motivated, once you see that function is coming back, you are more motivated to get the whole function back, but not doing it too rapidly or getting hurt. Yoga should not have any pain. That was the original description, right? So a lot of people, and also you have to involve other things. You have to involve your own mindset. You have to involve your own breathing, and all that. So I taught her, and I taught her how to do these exercises, and I told her you got to do this 3 or 4 times a day. But with these conditions, don't push it, let it ease into it, and then make it natural. And she did very religiously for 2 weeks, and she had all the fibrosis that was there before from the surgery and aftermath. That fibrosis has gone down, and she was able to move her shoulder much better. So she went to the physical therapist who was working with her, and that physio was amazed the results she got. Then she asked her, "What is it you do?" Then she said, "Oh, I went to Dr. Rao, and he showed me all these exercises. I'm doing them." Then she's, "Oh, we should refer everybody to him." Something joking, right? I'm not locally there. They are somewhere, Texas or somewhere. And that's the beauty about uh, the social media, that you can reach people that are not in your immediate neighborhood. So that is also goes with my philosophy of being a global citizen, and I'm there for all the patients around the globe. That's why online company appealed to me quite a bit, and I did work a lot on the COVID during the COVID epidemic through Clubhouse. We participated in big groups, raised a lot of money to countries what needed, and then really was available online so that they could call me and I could answer questions either um, how to take care of themselves, or what is coming up in the field, what is the status of vaccine, all that was happening at the time, right? So this online company's mission evolved, and I began to coach the physicians who are going to burn out. Not only physicians, but healthcare workers, nurses, pharmacists, and all that. And then I also looked at information technical people. These information technology workers are really having problem with information overload. So I began to work on that. All the entrepreneurial problems, all the information related problems like a brain fog, lack of sleep, lack of appetite. They're not really good at caring for themselves, right? So we can now develop the programs for that. And then I was able to coach the corporate leaders in servant leadership. That's why I'm talking about service all the time, right? Anyway, so what happened was that became a worldwide mission now, and so I'm reaching people in several countries. But for few years also, I was just doing just a EMN service, just be available, help people, and that was going well. I was very satisfied, right? Now at a stage where we want to scale up and expand, so we're doing some things for that. Meanwhile, I do enjoy the people that reach out to me for help or for kind of question or doubt or whatever, and done in the spirit of service, not always insist on just pay, otherwise we won't give you service. That is not kind of. And I write the articles in LinkedIn, And I kind of come on the social media here, in the New Vibe, Clubhouse, and uh, all these things are already on the LinkedIn, and YouTube and Facebook. So uh, what I'm trying to do is educate about healthcare system, educate about the limitation of the revenue-based health system, and how could it be if it is wellness-oriented health system and prioritizes people's wellness as the first thing. And how could patients themselves take responsibility for their wellness and be proactive about it? Understand what is the disease profile of their family, understand what is the condition of their body, mind, and inner spirit and all that, and then do some active measures of being well, uh, in a responsible way, in a understood things and all that, right? So that helps a lot, right? So that's what I'm doing now. So I do come here and then talk on some other people's rooms also. So they could come and talk here also. Uh, so if you have any questions or any doubts or anything that you want to ask me, I am available for a few more minutes. So come up and then I'll be happy to engage you. See, the way the day goes out for me, I do come up in the rooms when that is an interesting topic and I could add some value. Then I may put what I'm doing for a few minutes and come up and talk and leave. That is working out pretty good. And lots of times I may be in between appointments, and then I may see somebody coming up, and that's why how I do these things. And I have some lull. I come up here and talk. Okay. I mean, there's a regularity in me coming up, but not those times. But times are given to people who are reaching out to me with some kind of need or suffering or service, whatever they need, right? So in a way, it is very gratifying that I could use this level of commitment and this level of service after the stroke in 2014. So you're kind of grateful the choice you got. So I wrote an ebook called Second Chance. That's describing how I did the recovery I did, and what are the insight that could use for the useful for the people with stroke or other diseases, and how they could utilize them. That was intended also as a service. And I wrote books on obesity, books on so many different topics. One of the favorites I have is about self-realization. This is a fundamental thing in Vedanta from India, and I'm pretty deep into that. And what they say basically is you are not just this body and mind, you have them as tools, but what you are really is that awareness within you. And that awareness makes you act through mind and the senses, right? So that self-realization course I have, and the self-realization in the sense of if very few people will be interested, but the beauty about that is then you are really going through the life like you are in a boat on a river. The boat is piercing through the river, you know, but it's not letting the water come into the boat. If it does, you're going to sink, right? So the same thing with life is. They say you are one with all, oneness, oneness of all. You have a divinity within you, and the same is everybody else, right? And then you are equanimous in troubles and in achievements. I think that worked very well for me because I was able to be equanimous in the event of a big tragedy too, right? And you are not really attached to things in the life, in the everyday life. You do your duty, but you are not attached to anything. So, these three words I told you are from the Sanskrit. Bodh me ekta, that is consciousness, conscious being, oneness. Chit me samata, that means in your inner mind and mastishk, they call it, the intellect and all that, you are equanimous in times of wins and losses, right? And Vyavahar mein asangata. Vyavahar means daily life in your relationship with your people, with your planet, with yourself. You are kind of detached, you know. So those are valuable things for a human being to have attributes like that. You don't have to be a monk, but you could understand what is a monk's mind, and then really understand your mind management. Okay, that's what I do. So it's a wonderful adventure, uh, and every day something is revealed to you if you are willing to learn and really bring the joy in the form of service to everybody, right? That's all that's happening, and I'm very happy to come here and then share that joy that I get by just answering questions or just being here and sharing things. Um, so I see more people joining us here, and if they want, you can come up and talk to me about whatever. Mm. So, Christina Haldy, Kimberly, Dr. Robert James, Carol, Michelle, Mark Thurston, and Deb Chandler, and Amor Diaz, Tina, Western philosopher, Sandra Mott, Paul Clement. Okay. Thank you all for being here and listening to my just chatter. But I was trying to relate to you by explaining what could be, if you take things like they're coming your way and all things are good, if only you know how to respond. Remember the two theory I always talk about. Some of you might have heard. Buddha, the great Buddha, he talked about this two arrow theory. It so happened somebody came to him and asked him, "Sir, you were a prince. You were having all sorts of luxuries at the palace. Your father provided all of them, and you never saw anything because they made sure that you are not seeing anything negative in life. But one day you come out for a ride in a chariot with your friend, and then you see uh, old age, you see somebody dying, uh, it's a kind of old age and disease and the death, right? These three things. And then you embarked on this journey of let me discover the reason for this suffering and the solution for this suffering. You know? But look at you now. I think he was getting old by the time, and he has diabetes, Buddha. And so this man asked, "You have disease, you are getting old, and you're going to die. So, how is that you have accomplished all this?" Then he said, "Look, these things will happen, but then that is the first arrow. World will throw the first arrow at you in the form of all these things. But then how I take it, how I respond is my second arrow. I could bury the second arrow more deep by digging into the wound, or I could ignore the second arrow completely, not come to me because I'm not reacting. My teaching is about the second arrow, not about the first arrow. First arrow will happen, but how you respond to that, right? So with that, I will take leave now, and remember that the second arrow is in your hand, and you can really nullify it. Okay. Thank you, and I will see you again when I have the time. Thank you. Bye bye.
that was not an intentional join. Joyce, sometimes we're trying to join and it doesn't work. So I'm going to give you another chance in case that was your intention that you did want to join here. We just had a little technical glitch. So go ahead and try to join again.
You decide to make some tougher decisions about your life and where potentially you want to go. And when you start listening to that inner voice, and it's going to take you somewhere that may not necessarily make sense. And I think that that is quite interesting when you realize that